what to expect if you come see me and have me as your primary care. I like to think that I'm an extension of your family, the long lost uncle, so to speak. And I'm not just worried about you as the patient and you as your medical problems, but I'm concerned about you as a whole. I like to not view you just diseases, but you as an individual, as a person. So I'm Dr. Joseph Connor, and I've been with Prima Medicine at 3 locations: Tysons, Merrifield, and Fairfax. I am an osteopathic physician that received additional training in family practice medicine because no one cares quite like family practice. And that's the reason why I went into medicine. What to expect if you come see me and have me as your primary care. I like to think that I'm an extension of your family, the long lost uncle, so to speak. And I'm not just worried about you as the patient and you as your medical problems, but I'm concerned about you as a whole. I like to not view you just diseases, but you as an individual, as a person. Something I tell my patients all the time is, health is like the 4th most important thing to nearly anybody. And 3 before that is faith, and family, and finances. Other than that, the way I approach medicine, I try not to think your health is greater than these things in your life, because that's not how you treat it. That's how I'm not going to treat it either. What I look forward to is a long, continuous relationship with the patient, seeing you through the good times, through the bad times, through the uncertain times, and then all the way back to the good times again. Willing to be with you in all those steps, and the steps of confusion, the steps of the mundane. I want to be that doctor who's there for you in every care and concern I address. Second generation family doctor. So I grew up around primary care. My dad was a primary care physician. I always looked up to him. And the thing I liked most about the care that he had is his long-term relationship with all these patients. He used to bring me into the rooms and say, "This is my son, Joe," and they would talk about, "Oh, I remember when you were a baby." And I'm like, I don't know who you are, but he cared a lot. I think for the patients, they cared a lot. They saw that he wasn't just a doctor; he was a family man, and they like to know that their doctors cares about their family the way that they care about them. But from there, I took that care and compassion I learned from my dad. My mom was very diligent to make sure I studied well. So I took my smarts and I took that care and compassion and I put it into the practice of medicine. Osteopathic medicine is not just the training in medicine, but also a philosophical approach to medicine. And the main thing being that the patient is more than just disease. They try to have a holistic perspective. It's not just concerned about the body, but also the mind and the spirit. All these things together, it makes up the person. So it's important to not just treat the body, but also treat the mind, treat the spirit. We're not trying to put band-aids on symptoms. We're trying to get down to the core, the root cause of disease.